Hello everyone, I am Mahoney from the Opt-in for Life team, and with me today is Kevin Farrell.
Hello.
And we're going to be having a quick discussion with you about medical marijuana. Kevin here is our resident expert. He's put together some awesome materials and everything else, but unfortunately those were all designed for doctors. So we're not going to show you those today. Those PowerPoint presentations are great, but they're meant for medical personnel. Kevin, you know the questions and answers that most people have in their minds about medical marijuana. Prescriptions, what's prescribed for, what the state regulations are. So what are some of the top hot things that people tend to want to know about?
Well, I think the main question that people have is what are the indications for medical marijuana, and do I qualify for medical marijuana? So in Pennsylvania there are 17 approved indications, and one of those is HIV and AIDS. So in the HIV population, what it was studied for is primarily to help patients gain weight and to stimulate appetite. So it doesn't have antiviral properties. So this means that not everybody who has HIV or AIDS will qualify for medical marijuana. Even though they have the diagnosis, it's typically used to help people gain weight and stimulate their appetite.
Okay, so let's just put that out there so everybody's aware and understands. Medical marijuana will not maintain undetectable status.
Yes,
Right?
that is correct.
Medical marijuana is not a replacement for ART or your Truvada or Stribild or anything else out there, correct?
Yes.
All right. Stay on those antiviral meds, of course. What about mental health issues? Is there anything on the prescribed list or the allowable list for mental health?
Mm-hmm. So one of the indications, one of the properties it has is reducing anxiety and depression. So mental health, there's not a whole lot of I would say it's not one of the top priorities on that 17 list of approved indications. There is post-traumatic stress disorder. So the difference comes down to the receptor that the medical marijuana acts on. So there's opioid receptors, which normal opioids, they act on those. And the problem with opioid receptors is that they're on a part of the brain that can suppress your breathing. And that's where opioids can become really dangerous. If you overdose on them, you'll stop breathing. And obviously there's a risk of death with that. With medical marijuana, it acts on different types of receptors. And so those receptors aren't found in the same area of the brainstem that controls breathing.
Methods of delivery. What are the approved methods of delivery under Pennsylvania medical marijuana laws?
Right. So there are a few formulations that have been approved in Pennsylvania. So there's topical formulations, so gels, creams, ointments, bars that you can apply. There's oral liquid formulations, there's pills, like capsules typically, and then there is oils available for inhalation or vaporization. What's not approved in Pennsylvania is any raw plant form, so any flowers or buds or any edible type formulations are not approved in PA, and those will not be dispensed from a dispensary.
What do you do to get a prescription for a dime bag?
A prescription for a dime bag.
Yes.
Okay. You mean like a pharmaceutical product or?
Oh, just curiosity.
So, if you did qualify for medical marijuana, what you would go to these dispensaries, and well, first I should say the first step in the process, if you do feel like you do qualify, is to register on the PA Department of Health. So you have to create a profile, which involves just putting your full name, your address, driver's license or state issued ID number, that sort of thing. Then you have to see a licensed physician who has undergone the appropriate training, and then if they determine that you meet one of the 17 approved indications, they will approve you for that. And that list of physicians that has undergone that training is also available on the PA Department of Health website, pa.gov. So once that you meet those indications, then you have to go back onto the website and pay a registration fee of $50. Now that can be either reduced or alleviated in certain cases of financial hardship. But then you can go to your local dispensary. They will not dispense it in dime bag form. They will dispense it. There is physicians and pharmacists or even nurse practitioners or physician's assistants that will work there. And essentially, once you receive the approval from the physician, it's almost like you're going to a doctor's office. You will meet with one of these healthcare practitioners, and they will recommend products for you.
Does my prescription, if I were to have a prescription, come with a recipe to combine it into, say, confectionery products consisting of eggs, flours, typically fudge, in an 8x8 pan?
No, they will not. The products are all pharmaceutical grade, so that they're trying to standardize it and make it safe for patients. And that's kind of why edibles were outlawed, because the big concern is that somebody, whether it be children or somebody who the product wasn't intended for, ingest it not knowing that it contains active marijuana. So there will be no powder type forms that you can sprinkle in your...
So it's a whole industry being missed out on right now. I tell you, get the economy booming around here.
Yeah.
How do people initiate this conversation, so to speak, with their healthcare provider?
Well, keep in mind that not all providers are qualified, but certainly if you can look up the indications on the PA Department of Health website as well. If you feel like you meet one of those indications, I would say the starting point is to start talking with your regular primary care provider or specialist that you see, and get the discussion going. And then if they feel like it is appropriate in your case, they can refer you to somebody who is qualified, and kind of get the ball rolling from that.
And do you have any tips for our patients who may be considering medical marijuana on the best tacos or the nearest place to get a giant bag of uts?
Well, you know what? I'm relatively new to the area, so maybe the patients can tell me where to get the best tacos.
I'm still looking for tacos. I've been here for 13-something years, and I still can't find a really good taco joint. But that's because I'm spoiled, and I came from the West Coast, where there are 5,001 just on one block.
Yeah.
So it's
I think West Coast has us on that.
Yeah, they definitely have it going on. They were first to this whole business, anyways. All right. Was there any other parting discussion, commentary? Things that you think patients should know or be in tune with, or where they should be paying attention to, especially considering how you're talking about indications. Clearly, none of these indications are for infectious diseases of any kind. It's not meant to treat your infectious disease or keep anything managed. So we've always got to bear that in mind, but we should absolutely be looking towards indications and possible ways that anything out there can help us through the rest of our health and wellness needs. So what are other things that you think people should be listening to, just that one parting shot?
Well, I think one other important thing to mention is that, how is this going to be handled from an insurance perspective? Because that's a big question that comes up a lot too. And the truth is that if you look at other states that already have this implemented, like Minnesota, insurance companies there don't pay for it. So they don't recognize it as something that needs to be paid for, so that the cost gets passed on to the patient. And if you're thinking about what the cost what the cost of these products is, it really depends on the type of product, the formulation. But I would say it's anywhere from $30 to $100. And of course, there's the potential that multiple products can be recommended for an individual patient. They could be on tablets or capsules to take during the day, and then if there's immediate onset of pain, they can have the inhalation, which acts a little bit faster. So cost is definitely a consideration here, and this is something that insurance companies are not likely to pay for.
All right, well, that is something to definitely think about. Then contact your insurance company. Do you know if particularly patients on things like Medicaid or SPBP, are those covered at all?
So they will at least be able to waive the initial fee that comes with getting the state-issued ID, which is the $50 fee I was talking about. I don't think that they would end up actually covering the products themselves.
Okay.
So that would be passed on to the patient.
All right. One, to keep in contact with your case manager, certainly here at Hershey Medical Center, and also at our other partners within the Opt-in for Life program, Pinnacle Health, UPMC Pinnacle, Hamilton Health Center, and Alder Health, of course. Get in contact with your case managers, and they would be able to help walk you through that insurance process and find out who to talk to and get some definitive answers for you. That will be on a case-by-case basis, so we can't provide you the exact answer for every case. Okay, you've got to do a little bit of legwork on your own, but we do want to help guide you in the right direction, so talk to your case managers. And thank you to Kevin here, who has guided us in the right way and shown us the right steps. Unfortunately, guys, we will not be walking out with any dime bags today. I asked, I tried, I gave my best effort. But thank you, stay healthy, and we'll see you again soon.
Thank you.